is agnosia, a disorder of visual recognition. Patients who suffer from agnosia can see. And you'll see this as a theme in these different disorders I'm talking about. It isn't a problem at the basic motor or sensory level. It's at a higher level of functioning. In the case of agnosia, patients can see, but they have trouble sometimes interpreting what they see. And it also isn't a problem that they lack all knowledge of, for example, what things look like. But they may have trouble connecting what they see with their knowledge of what things look like, creating a difficulty in looking at things and knowing what they are. Agnosia can be very mild, or it may be very, very severe. And it can have some odd characteristics to it, depending on exactly where the damage has occurred in the brain. So, for example, you have some patients who just sometimes look at things and just for a moment, but longer than is normal, can't figure out what it is. But it isn't really too much of a problem for them. You have patients who have a tremendous problem knowing what almost anything is that they look at. Now, they may know what the objects are when they feel them, or when they hear them if it's an object that makes a sound. But they can't figure out what the object is by looking at it, even if they can describe what the object looks like. So, for example, you may have a patient who looks at a flower and you say, "What's that?" And the patient says, "I don't know." Well, what does it look like? Well, there's this straight green piece, and at the top there's a red part. Well, what is it? I don't know. Or, show the patient a glove. What is that? I don't know. Well, what does it look like? Well, it looks like it's made of leather, and there are these 5 pouchings on it that I don't know. It looks like maybe something could go in it. Well, what is it? I don't know. There are patients who only have difficulty with certain categories of objects. So patients have no trouble naming objects and recognizing them visually, except for vegetables. There actually are patients out there who can't recognize vegetables, but they can pick out a piece of meat. And they know people, and they know rocks. There are patients who have trouble with man-made objects, but not naturally occurring objects. So they have no trouble with trees and flowers and rocks and vegetables, but they can't tell you what a watch is by looking at it. But if they listen to it, and it happens to tick, they may be able to tell you what it is then. Again, great variation in the severity of the disorder, depending on where and how much damage has occurred. In the case of agnosia, I can't really point to one specific area and say, well, this is the visual recognition area, and damage here produces agnosia. There are a number of different areas that are involved in visual recognition. Clearly, the area in the occipital lobe just above the visual cortex plays an important role in visual recognition. There are large areas of the parietal lobes that are involved in visual recognition, but there are also some areas in the temporal lobe that are involved in visual recognition. And exactly what symptoms the patient experiences will depend upon exactly which areas of the cortex are damaged. Are they visual recognition areas? How extensive the damage is. And also, as we'll talk about in a minute a little more, whether the damage is primarily in the left hemisphere or the right hemisphere.